A mouth is a complicated organism, or it's a complicated functioning kind of machine. And in order to have it, if it's the reason that someone would need a whole mouth of restorations done or a full mouth reconstruction would be that all of the teeth have been destroyed for some reason. So what we want to do is find the cause of that and then make sure that we put the mouth back together so that we don't have the same cause. And so it's a pretty complicated deal. And but if done properly, then we're able to restore the teeth. They look like new, and they will not break down in the future. I had a specific patient that came to me with his mouth in a shambles. And he owned a big construction company. He's very busy, and he understands construction and how complex various things are. We sat down with him over a number of appointments and consultations to treatment plan, and we eventually, he needed a combination. He had bridge work that had failed, so he had restoration. He was replacing teeth with bridges connected to his teeth. So he was getting decay around those areas. So the first thing we did was make sure that he didn't have restorations that replaced teeth that were connected to his teeth, because the risk in that case were the teeth themselves. So we took all of the the teeth that were missing, we replaced those with implants. He did have some teeth that were hopeless, so we removed those, and then we restored the rest of his teeth. So it was a whole mouth reconstruction, and we gave him a plan and then a fee quote, and told him that there would be no change orders. In his business, you have change orders, and those are always expensive. And the treatment was going to take place over 14 months, and he couldn't understand how we could have one fee and then stick with it. And in the end, we did exactly what we did over a period of 14 months, several pretty complicated appointments. And from his temporaries to the final product, he was just really quite amazed. And then now, several years later, he's functioning. We totally changed the way his mouth looks and the way his mouth functions. And then as a result, by reducing the problems that caused the breakdown in the first place, he hasn't had any issues at all since.